we give you another one, and it's for free. So I
Wow.
always tell my patient the success of the program depends on your
Willingness to phone
mental
you.
and mental status.
And mental status, yeah.
Yeah.
Don't be stressed out. Just
Don't be
calm.
stressed out. Yeah,
No.
because I found out that some of my patients, I teach them, they really do good here in the hospital because they want to get out. But the moment they step out, they got a lot of stress factors at home.
Yeah.
Yeah.
They get panicky and they give up. And halfway, I have to meet them again and say, so what's going on? But they actually can perform. But see, it's your medication, it's your treatment, it's your plan. So if you want to do it inside the living area, inside the bedroom, it doesn't matter.
Mm-hmm.
But first, before you start hand wash,
Yes.
look at your cell phone for the picture.
Yeah.
The picture
Okay.
will speak for itself.
Right. It will.
Yes.
Okay.
And then by the moment, okay, you need to prepare the ingredients first before you cook. That's what I always
Yeah,
say.
yeah, exactly. And have it ready.
Right?
Have all
Yeah.
the spices
So let's ready everything first.
Okay. Yeah.
Rip it open whatever you need to open,
Yeah.
and throw it in the trash here.
And then if I have
Yeah.
any questions, I'll ask. Or if you see I'm doing it wrong, you tell me.
You
and-
probably don't do it wrong. I
Well-
honestly tell Tanya is the senior coordinator now, but she's been teaching for many years, and she is so passionate about
Oh, she
everything.
is.
Yeah,
I
she
just
has
love
a
her.
big heart.
Oh. You
Wow.
too.
we always go along with this. Okay, I told her, you know what? If the patient have questions and I'm working, send it to me, not yours anymore. You're not working today. Send it to me. Okay. So just to remember, prepare the ingredients before cooking.
Yes. Yeah. There we go.
I always said that because we are not supposed to be stressful. We're
No.
supposed to be having our own time for the medication.
Right.
And do remember, you can never get wrong with your pump because only us can set that up.
Right.
You can never get wrong in that one.
Okay.
Perfect.
So I don't have to put this in here.
You need to. You
Yeah.
need to. This is your pump.
Oh, right.
Your
So-
tubing.
Okay. So,
So you
step
can-
one is tubing, priming.
Yes.
Priming the
Like
tubing.
everything, ingredients first, right?
Yeah.
Okay.
So I start with this.
Mhm.
Okay.
Take your time. We're not in a hurry.
Yeah, I'm just gonna remember. Oh.
Remove the papers.
Yes, remove the papers.
Release it.
Yeah.
I love my patients when they can play around and then they become relaxed more of that tubing.
Yeah.
This will gonna be like your best friend for a little bit of a
Yeah.
time.
That's
Yeah.
true. So I want to get
Yeah.
to know my best friend here.
Yeah.
She's done really well considering the shock of
Yeah.
all of a sudden having this.
Like
Like,
yesterday,
Yeah.
it's
she had
like,
no
oh,
clue. Like,
Oh.
I thought I was just gonna get, some tablets.
Yeah.
That's another thing, Han. But don't you worry because at the end of this, you are a certified nurse. A specific procedure with a specific program.
we
Not all the nurses knows how to use that. Only us, coordinators and our patient.
need.
So you can
Neat.
even teach the other nurses.
Okay, so I get.
So you
yeah.
get this first set
Okay.
up.
I do the sapphire.
I
first.
will. I'll show you my reminder always.
Okay.
When I always tell my patient, "Hun, everything is made to fit. Okay,
Everything's
everything
made
is
to
made to fit, right?" So when I put this in, I open.
That's
then
the cartridge,
I
yeah.
always start from the bottom, anchor, anchor
Yeah,
from
I
the
can do that.
bottom,
Okay.
and then push latch, and then when close, and then when I take it out, always starts from the top. Push the metal up and take out. Now
Okay,
it's
so I'm
yours.
gonna do it. Okay.
Yeah.
So here they are, everything laid out. Oh, I need to add the tubing to the cartridge.
Yes.
Okay, so I open it up,
Mm-hmm.
and then
Anchor.
the anchor
Yes.
down here.
Yes. Perfect.
Okay. And then just push.
Latch.
Yeah.
Close.
Now, if I want to take it out, I open
Then
it.
tap from the bottom. Now
Um,
tap. Push the metal from
oh.
the top.
Oh,
This one.
up here.
Yeah.
Push it down.
Push it up.
Push it up. Yeah, you
So
just said that.
it's a reverse cycle. Bottom,
Oh,
top,
yeah.
top, bottom,
Okay,
right?
I'm gonna do it again.
Yes.
So put the prongs down in the bottom.
Yes.
Push down.
Latch.
Yeah,
Very
and
good.
then push down and up. I mean, push up. Yeah.
Yes. So it's
Yeah.
always reverse. Top, bottom, bottom, top to take it
Yeah.
out.
See, I'm doing it.
All right. There you go. She's a master
Just in
pro.
case she forgets, right?
She's good.
I'm trying to have kinetic memory, right?
Yes, yes.
Okay, now
I
we
do-
close it.
Yeah, very good. You're good. You're good. You're good to go.
Okay.
Now you just need to make sure your little bug right there is connected to your.
Oh yeah. So
tubing.
okay. So I rip this out.
Yeah,
Okay.
and you need to poke it, right? It's hard. Very good.
Okay.
And you need to poke it.
Yeah.
So you got to see the margin line. Take it off. And you see the margin line up to that line. You see that? Right there?
Oh yeah,
Yeah,
right here.
that's it. Yeah.
Okay, and then poke it
Mm-hmm.
up to the line.
You can actually like push and twist at the same time, so it's more easier to get it.
Am I doing it wrong?
You're doing it right. It's really tough.
Okay.
You have to remember nothing comes easy, hon.
Okay. There. Then is that
okay,
correct?
very
Okay, correct.
good, very good.
Okay.
So I know it's not been specified, right? But I
Oh.
always said that
What about
I
the-
love
yeah.
my bag with gravity. Because
Oh, okay.
even though you can put it in the bag later on,
Yeah, I did.
but in the beginning, I always wanted to have gravity.
Okay.
Because when we try to put the, to prime it later, it
Yeah.
will gonna say occlusion
Oh.
or air
Oh.
problem because it's trying to exert too much force to get the fluid
Maybe that's
out.
where you were getting that message all the
No,
time.
I don't think so because
No?
I remember Tanya said something about let's try to get some of that air out of the bag, and I don't know what
Oh.
she did. Like
You don't need to, as
You
long
don't
as you give this little gravity
Yeah,
when you try
gravity.
to prime
Okay.
it.
Okay.
Now let's pretend I'm the gravity, I'm the hanger.
Yeah.
Okay, now you wanna do your whole thing. It's fine.
Okay, now it's priming. Yeah, priming the.
Because the priming we'll do it later because totally it is because this is the actual medication administration and we're done, right?
Mhm.
So you can start with your cleaning up the line.
Yeah, cleaning up the line.
Mhm.
Isn't that called priming?
Yeah, the priming is actually in the machine.
Okay, so what I'm
So
doing
it's
is
just a flushing and cleaning
yeah,
up
flushing.
your
Yeah,
pit line.
flushing. Okay.
So this one we can do it later. You can do this hand.
Yeah, of course.
This and this is your tip line for your
Okay.
pit. Your easy access.
Right,
I
right.
call that easy access.
Yeah, so you have to disinfect both
Yes.
pieces, right?
No, just this
Just
one.
this.
Just
That's
this
just
one?
this. This
Okay.
is
Because remember, these are for the nurses to touch. This
Yeah,
area
I
here,
don't touch
not
that
yours.
at all. This is all I touch.
Yeah.
Yeah,
Okay.
so I clean this for 15 seconds.
Mm-hmm.
And how about the end of this tubing?
No, those are sterile. That
those
came
are
right here.
sterile. Yeah.
Mhm.
Okay.
So those are good.
Okay. So
Now you can get your. Okay. So have you removed the air on that? You need to remove the air.
oh, don't I have to do something like? Oh yeah, right. I have to
Okay.
take this off 1st
Mhm.
There, and then I just yeah, go
So
down a
pull
little bit.
back,
Yeah, pull
release
back.
the pressure. Pull back, release the pressure. Did you feel that?
Oh, it's
It's
starting to come out.
very-
Oh, yeah.
You're very strong.
Okay.
That's good. It's
Yeah.
okay. Then attach it.
Okay. Then
So
put it
when
in here.
so when you attach it, just hold like a pen. It's fine, hon.
Okay.
When
just-
you
I
attach
find
it,
it
you
funny.
can hold it like this,
Yeah.
and then push and
then screw.
clockwise screw to
Yeah.
lock it, counterclockwise to
Okay.
unscrew.
Yeah, that's what I thought. I did it this morning with Tanya because she had me flush the line.
Yeah.
Okay.
Okay. And then flush. So you are now at about 8, right?
Right.
So give me a 2 big flush. Remember, hon, before you flush, make this arm straight where your pick line is.
Yeah.
Okay? Push 2 arms. Push 2 mils to your arm there.
And
Perfect.
stop.
Then pull back. You can hold it like this to make it easier.
Okay, and then pull back.
Check for the blood right there.
Oh yeah, she told me I should turn my head.
And not necessarily.
Not unless the blood isn't.
Did you pull back and see the blood?
No, I didn't see the blood.
Yeah, I can see it there.
No, it's supposed to come down
Yeah.
in here. Okay.
So relax the arm when you try to pull back and
Okay.
see the blood.
Okay.
So yeah.
Oh, there it
perfect.
is.
Perfect.
So I can just stop.
Then you push pause. Then you go to your push pause 2 mils at a time.
There.
Then another
You
mil.
want another one? Okay.
But this time you only need to check your patency once a day. That's before you put in the next bag.
Yeah.
You don't need to check it
No,
every time.
no.
You just need to flush it with another syringe. Okay?
Okay.
And release the pressure. Pull back. Release the pressures.
Yeah.
And then push the air out slowly.
Okay. Pull back.
Yeah, very good. And then push the air out.
Yeah. There.
Okay.
Okay.
And
And,
then-
it's and screw it in. Yeah.
Yes. Do remember the reason why we release the pressure, because what happened if you
Air
don't?
embolism.
No, it's
No.
one thing is that when you try to not release the pressure and just push the air out, it
Yeah.
will shoot to your cell and
Yeah.
come back to you.
Yeah,
So
Okay.
you got 2 big meals there. Push, pause, smile. Push, pause, smile. Push, pause, smile. Push, pause, smile. There you go, hon. Perfect.
So when I had the blood there,
That's
that was you
perfect.
asked me to withdraw, and that's what made the blood.
Yes,
come out with
the pressure,
pushing, the
yes.
pressure of withdrawing it a little bit.
Yes.
Just
So
to make
you have
sure.
to
The
with-
patency is good.
Yeah.
The reason why we need to check the patency, you know
What
what?
do you mean
Even
patency?
patency is it is in the right flow. We are
Okay.
having a right flow. We have no blockage. It's
Yeah.
in the right spot.
Okay.
What happens is sometimes when we try to pull back, we can push fluid in, but when we try to pull back, we cannot get a blood.
Yeah.
You can still give the medication,
Yeah.
but do remember, if you are close for your blood work, let's say your appointment this Friday,
Yeah.
like
Yeah.
for blood work and PIC care,
Yeah.
you are meant to get that blood specimen from your PIC line.
Right.
If that happens and then Tuesday you already notice it's not giving you blood back,
Yeah.
then Wednesday you need to let us know
Yeah.
so we can send you to angio department or we can get that cleared out
Right.
for you.
Right.
Some component of the blood is called fibrin. It's kind of like a white sheet in the
Mm-hmm.
blood, and it kind of block your line. The
Oh,
line
like
in you.
D-dimers,
Yeah,
like
so
clots,
that's
yeah.
why when you try to pull back, it's not getting blood back because the fibrin is covering the
Yeah.
tip of the line, and we need to get that out so that when it's
Yeah.
time for your blood work,
Yeah.
we can access your PIC
Okay,
line.
this is good.
Okay, now
Okay.
you can let go of that. Don't worry about that. Let go. You
Okay.
can have that dangling. We're focusing on the pump now.
Okay, I have to clean this again?
Of course.
Yeah, okay.
Remember before
Yeah.
you stick anything.
Yeah.
Okay, good.
Okay, now focus on the pump. I guess I'll turn it on.
Yep.
Okay. Just I'm gonna take my glasses off here.
You can hold it, hon.
Okay.
Make yourself comfortable. Yeah.
Okay.
And then home care. It will says home care, and then
Yeah.
accept, like a touch phone.
Yeah, I was working with this a lot today.
Okay,
so
accept.
yeah, accept. I'll
Mm-hmm.
Okay.
You can figure it out. And
repeat.
always prime.
Oh, that's the first thing.
Yes.
Yeah, prime.
Always remember.
Prime the pump.
Every
This is
day,
the pump.
when we change your bag and we change your tubing, you always have to prime in the beginning.
Yes.
The first action.
This is the pump. It needs to be
Yeah.
primed. Disconnect patient. I'm not.
Yeah,
connected.
you're not connected.
Yeah. Okay.
Before priming, failure to disconnect may cause injury to the patient.
Yes, definitely.
Right?
Yeah. Okay. Prime.
Okay. See?
Okay.
That's fine. Now I want you to hit mute.
Yeah.
And then okay.
Oh, sorry. There.
Mute.
Yeah.
And then okay. Mute. And then okay. Try okay. Okay, hon. Right, there you go. And then try to take the cover out.
Mm-hmm.
But now make sure it's clean, okay? Pull it, hon. Pull. Very
Yeah.
good. Okay, then you can yeah, and then try to hit prime again.
Okay.
The same thing. Just go.
Yeah.
Prime,
There's a
prime,
lot
prime.
of fail safes. Yeah.
Yeah, see? You can see
So
that.
it's going through here.
Yeah,
It's
you're
priming.
still up right there. We want it up to that last bubble to get out, okay?
Yeah.
So in the clinical study, the wastage would be probably 0.001% to affect your treatment. Not at all, right? It's just because we want more to be safe that you are not infusing air at all.
Right.
And this machine is very, very smart than other machine compared to that 361 there.
Oh, okay.
This, even with a little air, it can detect. And then it will trouble you, it will beep on you, it will alarm on you. But throughout with this, we can troubleshoot it. We always have the code, 1234 for your personal code. As I told you, okay, is that all out?
Oh, yeah, it's coming
Yes,
out, yeah.
Very
So I can
good.
stop it, right?
Finish prime.
Yeah. When it's coming out.
Yeah. And then prime, finish.
Yeah,
Reminder to connect the
Oh, yeah.
line. Okay, press okay. Then I want you to clean again your
Mm-hmm.
access line,
Yeah.
easy access line,
Of course.
and then connect it together.
There.
Yes.
For 15 full seconds.
Mhm.
Okay.
So do remember tomorrow is the same time you need to change
Yes.
it. And then tomorrow before you even like put it on, you can actually check your camera or your video.
Yeah.
Yes.
Right?
Yeah.
Very good.
And so,
Attach it.
yeah. So
Yeah.
it's one of those. Yeah.
Yeah, you need to push this though. This is moving, okay? But
Okay.
that's your screw.
Oh, yeah. Right.
Push and then screw.
Yeah. Just like the last time.
Yes, very good.
Good.
Now, always hit, repeat, last infusion. That's
Repeat
it.
loss
Yeah.
infusion.
Yeah, that's yours always. Prime and repeat loss infusion. This is your medication. You're having a Pen-G continuous infusion. You are supposed to infuse 1 million units per hour,
Yeah.
and this is your
Yeah,
exact
it's all
medication.
set up
So
for
next,
me.
yeah,
Next, yeah, I see that.
you can never change that. It's only us who can change that.
Yeah, and then it says, okay,
Okay.
okay.
And then start,
Start.
and that's it.
What? That's great.
Yeah. And do remember, Han, your bag is very smart. 5 or 10 minutes before it gets done tomorrow, it will gonna alarm you, telling you that the infusion is almost done.
Mm-hmm.
Once it alarms, press to unlock is always the code 1, 2, 3,
Yeah.
4,
Mm-hmm.
and then just continue infusion. Once it's totally done, you see some tubings, everything needs to be thrown out. You get your new stuff and ready to go again. The
Right.
same procedure that we did.
And do I press stop at that point?
You can stop it or quit infusion. It
Yeah.
doesn't matter because
Okay.
whatever happens, always when you, even if it shut downs and it suddenly quit on you,
Mm-hmm.
you can always hit repeat last infusion and we will have the same ending and beginning.
Oh,
Right.
that's
So
great.
it can never go wrong. Right?
Okay. Wonderful.
Okay, so I just want to emphasize to you, although I did not emphasize it in the very beginning, the reason why you have this yellow Dutang with a doctor's copy of order is because you also need to verify your doctor's order to your bag. It says Pen-G injection. That's good Pen-G injections. It might say they're continuous, but this is the right one. Another thing that you need to check and compare your name. You got your name, perfect. You got the medications, Pen-G and dosing, perfect. And most of all, it's not expired. It's in the back. You check on it. You see the
Where does
medication.
where does it say the
Expiry date May 6.
Oh, wow.
So make
Okay.
sure it's not expired. It happens before that it has the perfect dose, the perfect medication, but it's not your name. Please don't use it. Call us back. We'll send you more. We'll send you the proper one.
Okay.
You did good. That's it.
Thank you so
All right.
much.
Yeah.
So now we got to take you for lunch.
Oh, no. I have another patient to see.
You,
I'm going to the ward for another patient to teach.
Well, thank you so much.
Yes, you
And
did
so-
good.
Oh, well, thank you. And so you recommend that I keep it
Oh, man.
like this, as much as possible.
Actually, the other way around. But you know what? It doesn't matter
Yeah.
because in the beginning, the most troublesome is the pressure to begin with. But once the flow gets in, the pressure is maintained.
So,
it's fine.
so we need to find something to hook it up on at the beginning when she's priming it, right?
Yes, like
When
a
I'm-
friend can hold.
like
a
when I'm
hammer.
doing it.
Or maybe I can hold it
But
for you.
now that we finished, I can just put it back in the case,
Just
right?
wait, Dohan. I need to put a sleeve for you.
Of course.
The longer one, I told you.
Yes.
And do remember, I don't want any of these sleeves tight on you. This is only supposed to hold up for your line and to cover up your dressing, but not necessarily to create pressure.
Now, what I had didn't seem tight to me. Did it seem tight to you?
It is a little bit tight,
Oh.
but you know what? You cannot avoid that, especially if it's like rolling into you, right? Because this kind of mesh always like roll down. So I do suggest if this roll down and create pressure in the PICC line side, I'd rather have this cut off and do not use it.
Like
Okay.
not use this mesh.
Yeah, if
Yeah.
it's creating pressure on the PICC side, right?
Okay.
Because what we try to do to protect most is the PICC
That's what you
side
want.
and the dressing. So it's not supposed to be the
So
troublemaker.
so do you think that mesh is what caused that sudden pain?
It could be, but I want you to be mindful also. If you still experience the same thing and you have palpitations, like your heart and your breathing get affected, you might need to call us right away
Okay.
just to make sure you did not develop any air embolism or any blood clot there, okay?
Okay, sure.
But
Oh, this one's better. I like this better.
That's way better because
Yeah.
it holds it in place, right?
yeah,
Mm.
because I just told you I want this straight, okay? And then this other one, I will stretch it again.
Yeah, so here's the one thing I control with the tubing here. Yeah.
Yeah.
That's the
Yeah,
yeah,
because it's
right by my right hand.
but the most site that I would like you to watch out, especially when you try to push your fluid or medication administration, is this side here. That's
Watch.
always, yeah, because
make
if
sure
your
that's-
arm is a kink or it's
yeah.
not properly straight, when you even try to push it, it's very difficult.
Thank you for
Proven
the
and
reminder.
Yeah, proven and tested for many patients.
Yes.
We encounter different issues, but we're here to help. We can even do FaceTime.
Wow.
So you can
That's wonderful.
FaceTime me or Tanya. If I'm not working, you can have Tanya. If Tanya's not working, you can have me.
So which one do Tanya has told me this phone
I'm
number?
gonna give you my number as
Okay.
well. Okay.
Thank you.
So yeah. Like it's I know it's cute, but I do FaceTime with patients
No,
too,
it makes
and
sense,
it's
yeah.
like sometimes I got 10 o'clock call and then they say
I hope
Maria.
you get on call pay.
No, we don't, but it's okay. It's
Oh.
part of our plan. There is
Oh.
only a few of us. Like there's three
Yeah.
people
Oh.
only in this program and one part-time
Mhm.
and one casual. So there's few people to help and we are always ready to help right there.
Wow.
So you
So-
think this one will be okay and not beep all the time?
I honestly think this is already good because you don't even have any air that can trigger it.
Right.
Unless the machine is really broken, that's gonna be the worrisome again for you. But here, hon, let's put it in your bag now.
Yeah, sure. That sounds good.
You're gonna ask her about, you know, how you had trouble with your dog jumping on your lap?
Oh,
Like the extra cord that's hanging down, are you
Yeah.
able to hook that up somehow?
yeah, this is the extra, like this is
Yeah.
a lot of cord. Is there some way that I can hook that somewhere or just
Or
make it smaller
just as
because
long
my
as
dog
it's-
jumped on my lap?
Well,
and I thought,
you can put like a hair tie like this,
Yeah.
as long as it's not tight that will block the
Yeah, the
line.
cords.
Like
Yeah.
the cords. You can even make it shorter.
Yeah,
Like anything as long as it will not block
it's
the
not
line.
kinked.
Yeah,
That's not
like a light twist tie or
light
something.
Yeah,
This
no, we cannot allow because I told you this is very smart. Anything that it's like it says
If it's constricted enough, it's gonna tell you.
right
Yeah.
away.
Yeah.
And that's like for instance, that's when that's what it kept saying to me this morning.
And also be careful.
See?
I would like to emphasize this one.
Yeah,
This when you are inside the bag, this should not be kink as
oh, it
well.
should never be kinked. Yeah,
Yeah,
that makes-
because
Okay.
you can overlook that, but that's gonna be your problem.
yeah,
You can so always bag straight, lines,
always
tubings straight.
Yeah.
There,
yeah, like that.
yeah,
Yeah, like that. Okay.
yeah, straight,
It's sort
straight.
of on the side,
Yeah.
the side,
Yeah,
and not kinked.
Yeah.
The nozzle's not kinked.
yeah. Because anything kink is a problem.
And this is what I was getting with.
Okay, please find possible downstream occlusion. See, that means it's kink somewhere,
But it wasn't. I kept looking and looking.
even inside the bag.
Yeah, I took it out and was looking at it,
Okay,
Yeah.
that means
and it kept saying downstream occlusion.
yeah. So when it happens like that, you can actually take off the whole this one out from you, and you need to reprime it.
Yeah,
Just do the repriming. Just hit repeat last
that's what she
infusion
had me
again.
do. She had me
Mhm.
flush it. She was flushing, not priming. Like I was doing the syringe this morning into
There is
this.
always two way to troubleshoot. It could be your main line, the PIC line, the easy access, or the machine.
Yeah.
But once the machine detects air already or occlusion within its own area,
Yeah.
I would suggest do both. So you can reprime the line,
Yeah.
and then once it flows well, you see no air bubbles at all, and then you also push pause in
Push,
your
yeah,
line,
yeah.
which is it makes straighten and the pathway is clear.
Yeah.
Then attach it and see again.
Okay. Yeah.
So yeah,
Yeah.
so
Thank you.
You're welcome.
Thank you so
Yeah,
much.
I will be working over the weekend, so you can actually FaceTime me if you have questions.
Okay.
So, and Tanya will be covering the rest from Tuesday, I think.
Well, much appreciated, Maria.
You're welcome.
All right, I can turn it off. Right?
Yeah. Thank you.
There you go. All ready to go.